Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
For today's demonstration, we have our hypothetical patient and we have used our surgical guides to physically place the implants. In order to get to the place we are now, we remember that originally our patient had no implants in place, and we had a model of our patient. On our model, we determined the physical location of the implants and marked them, and then we blocked the model out so that we could make our X-ray guides followed by our surgical guides. So here's an example of a blocked out model for our patient. Many times, to determine the location of the implants in the posterior area, we may do a diagnostic setup. In this case, we set a couple denture teeth in the area where the teeth were missing in the posterior. So having determined the location of our implants, we went ahead and with another blocked out model, we made a radiographic guide. Note how the buccal aspect of the radiographic guide has been contoured to simulate where we would like the final gingival margin on our restorations to end up. And so by making that contour on our radiographic guide at the time the surgery is done, the surgeon can place that guide on the patient once they have laid the flap in this area. And then when they go ahead and contour the crest of the ridge prior to placing the implants, they contour the crest of the bone, the ridge crest, using the ridge crest preparation guide. So what they will do is take their 2.8 millimeter measuring stick that comes with their surgical drills, and they will make sure that they have relieved the bone in these areas so that the bone is 2.8 millimeters lower than the final gingival margin. And likewise, the same thing was done where our single tooth implant is in place. We had made our single tooth radiographic guide and ridge crest preparation guide as well, and we can see that this was fabricated in such a way that the cervical extent of the radiographic guide was consistent with the free gingival margin of the teeth on either side of the proposed implant placement. And then we've now waited 3 months for healing, so now we're ready to take our impressions for the patient and finish their restoration. In preparation for taking the impressions for the patient, you want to go and get the green requisition form that's available at the dispensing desk. So I'll set our requisition off to the side, and when you check out the implant ratchet set, this is our toolkit for doing the prosthetic portions of our implant restorations. We have a torque wrench, we have some screwdrivers for placing the various components on our implant restoration. So if we take our patient and I pick out a screwdriver, and you can see it may show up reasonably well, the end of this looks a little bit like a star shape or a Torx wrench. Now that shape is also the recess in the top of our healing screws. And so this wrench fits very securely into the little healing screw. Now many times when patients come back for their 3-month visit, there will be little bits of food debris that plug up this little recess. So what one wants to do is take an explorer and go in here to make sure any food debris is cleaned out, and then rinse it with an air water syringe. Once that's been completed, the screwdriver fits into the end of our healing abutment, and we carefully just unscrew the healing abutment. And that will lift right away. So when that's been done, so you can see the soft tissue tunnel or tube that goes down to our regular necked implant. So the healing screw has been taken off, and we're going to now come back and place our regular abutment on. This is the real abutment that goes in the patient's implant, and you can see that the solid abutment has a flat side on it that's an anti-rotation, side, and then 180 degrees opposite the flat side is a small groove on the side of the solid abutment. So now for placing the abutment in the implant, we take one of the drivers that has a hollow opening in the top of it, and where the small black line is, it's difficult to see, but on the inside of this hollowed out driver is a small little positive bump. And so when we place the solid abutment in the driver, we line the groove up with that black line, and then those will friction fit very nicely. So we place our solid abutment in the driver, again lining the black line on the driver up with the groove on the solid abutment. That's placed in our patient, lined up carefully, and we just tighten that down, finger tight as we can get it. Now I'm going to set our patient aside just for a moment and take the pieces of our torque driver out of our prosthetic kit. So these two pieces of the torque driver fit together, one slides into the other, and you can see how this end shouldn't be crossways, it should fit in snugly. And the other part of the device goes in the barrel and is screwed in place. So those three pieces assembled, our torque driver is now assembled, and the end of it by our flexible wire, there's a little arrow on this piece. The arrow points toward the flexible wire. The torque driver fits over the top of our abutment driver, and now when we torque this to 35 Newton centimeters, we touch only the flexible wire portion, and we torque that until we see that deflection go to 35 Newton centimeters. And once that's deflected to 35 Newton centimeters, we have now torqued our abutment to manufacturer's specifications. What I'm going to do now is, in like manner, I'm going to remove the healing abutment from our wide neck implants. Now the one difference between the wide neck and the regular neck solid abutment is the wide neck abutment is large enough on the top that the nut driver that you use to remove the healing cap is exactly the same one you can use to place the solid abutment. So here we place the solid abutment on, that's our wide neck solid abutment. And here again, we take our torque driver. The torque driver fits on this just like it did the other. We now go ahead and start torquing this until we have, when we look at our torque wrench, we have 35 Newton centimeters of torque, so that we know this is then torqued to manufacturer's specifications. For our patient, we now have our regular neck abutment placed and our two wide neck abutments placed. The next thing we want to do is to take a polyvinyl impression of our implant abutments in place.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.